Health Talk series, our special guest today is Dr. Anand Kanjolia. He has his own medical practice in Springfield, Western Massachusetts, and also is very active in the local medical community as well as other community and charitable work in the area. We are going to talk to him today about physical exams and other related issues. Dr. Kanjolia, welcome to our studio.
Thank you, Upendra.
Yes, you are welcome. And again, thanks you so much for your time.
You're welcome.
So,
it's my pleasure to be here.
excellent. So, those of us who go and ask to take our annual physical exam every year, go
Right.
to our physicians and patient care. So, let us start. What really it is, and what are when I go to see a doctor, what are the questions I should ask?
So, Upendra, I can tell you there are two things very important. First and foremost is that physical exam is basically yearly preventative care exam. So you can divide it into two ages because I'm being in adult medicine, we do about 18-year or older patients we see. So you can say 50 and below and 50 and above. Under 50 years of age, you do not have to see that often unless you have some illness or severe issues or something going on. But if you are doing a regular care and everything is normal, you can see every 2.5 to 3 years when you are younger. Our mid-40s or around when you start hitting 50s, you may want to see a little more frequently every other year or so. But after 50, it is recommended see every year. And every age group has a different meaning, and you want to make sure that every issue is addressed. And preventative care exam basically means you should screen for diseases which can help us to prevent something bad in future. So start with that. We just want to do a general exam in which simple thing is you will go and see a doctor, whether under 50 or over 50, if you divide into two. First and foremost thing will be similarly go and check, ask about any problems or issues and family histories. And family histories are important to ask. Allergies are important to ask. And family histories are important to ask because then you can decide and plan exactly if this person is prone to or is going to get some problems in the future, and that will direct your preventative screening care. So we do that way, and start from there, check your blood pressure, pulse, simple things, which you do. And general exam, usually you check every system, and it's sort of a screening exam. You will pay attention to if there are any problems, which when a normal person is coming without any problem, there will be none. But if you have any diseases, illnesses, it needs to be followed.
So what are the key illnesses, if you have that, you are prone to that
Right.
this physical exam?
Absolutely. So as we age, a lot of diseases do increase in frequency. Then they start happening more. Aging itself causes more disease. Bigger problem in USA, the main cause of death, you will look into that. Coronary artery disease, number 1. Lung disease, cancers are number 2. Then lung respiratory diseases are there. Younger patients, accidents are there. Accidental injuries, homicides in much younger patients, older population, falls and injuries are there.
What about diabetes?
I'm coming to that.
Okay.
So diabetes is also there. It was lower in the list of 6th or 7th, but it is gradually making an upward coming.
And especially among Indian population.
Absolutely. And a lot of the endocrine specialists can shed more light on it. But as a primary care physician, in our initial testing, if blood sugars are higher, you want to make sure that they are followed and checked, and diabetes has been ruled out. A lot of people have a family history of diabetes and they are prone to catch it. Doesn't mean everybody will get it, but they are. So other factors do make a difference. So heart disease, diabetes, these are, and high blood pressure, cancers, these are there. So you want to do, and healthy lifestyle. A lot of people are obese, overweight, which is another bigger problem. Minority groups are also more commonly and much more prone to it. African American population, Hispanic population. Indian population, you may not find that many overweight, obese people. There may be, but lack of activity, inactivity, and lack of exercise can also make you prone to some diseases. So as a part of preventative care, you want to encourage activity as well as health care, what the exercise timing is, and what are the recommended timings for everybody, what is the correct amount of exercise.
So now in terms of preventive care, another question for you is colonoscopy.
Absolutely.
And so we have read, here many things, that for Indians it is not need to be done, or, it is more important for the Americans. So what is your take on that?
Well, the take has been this, it has been all taught to us while we were doing training, and in the practice we have seen once we immigrated to the country we are living, which we all are, we usually inherit or acquire the risk factors. So there is a risk of colon cancer in this country. So we Indians are also there. So there is no need to be ignoring that fact. The recommended age is 50 years of age. So you should do the screening colonoscopy or yearly stool exams and everything, and with nothing wrong with it. So far the data is not out that anything better than colonoscopy is available. So I recommend to my patient to do it. And I recommend anybody who is above 50 should get it done.
And how often it should be done?
Well, it is, if everything is normal, if nothing is there, the usual recommendation is repeat in 10 years. Depending on what you find, how you find, there are many details. It can be done in 3 years, it needs to be repeated 1 year, 6 months, depending on what they find, which I do not want to go into much more detail, because then gastroenterology, they take over, and they are recommended, schedules and timings. But if there is a family history of colon cancer, there is a family history of colitis, ulcerative colitis, Crohn's disease, these are the diseases which may increase the propensity to catch your colon cancer earlier. Depending on the index case in the family, when it was diagnosed, you may want to do it a little earlier. So those things you can find out when you visit your primary care physician for a preventative yearly checkup. That's why in 40s you should do more often, every other year. In 50s you should see them every year. Younger age you can see every 3 years.
So in preventative care and other issues related with that, what are a checklist of 5 things you tell a patient?
Well, I don't know if these are 5 things, but the simple checklist is a general physical exam, besides looking at if there is any problem they're presenting with. If not, then how much exercise they do, what they're eating, what their other habits, hobbies. It's a general exam which you will do. And after the end of the exam, if there is nothing abnormal, you will order the blood test. You want to make sure the sugar is checked out, fasting, most importantly. And second thing is cholesterol is checked out. Depending on age and depending on family history, you may want to check PSA, although lately it has been so much into controversies that PSA is not beneficial in low risk people. It is beneficial only when there is a high risk, like if there's a first degree family relative who has a prostate cancer, then you do it. And the ages have been also changing. The same thing is in women's cases, the mammograms. So there are a lot of controversies.
So is there any difference you have seen, because our viewership and the readership is mostly Indian and South Asian? Have you seen any demographic changes in terms of physical preventive care, Indian or South Asian versus Caucasian population?
Well, more or less similar. There's not much of difference. Some Indian population are prone to a few more things which we will not think of sometimes. When we travel, we get more prone to catching malaria because we come back. This is the disease of travelers. Although lately malaria has been insurging and it's making surgency here in USA also. But until recently it has been a traveler's disease, more or less. Second thing is diabetes is also more popular, I should say not popular, more commonly diagnosed now in Indian population, and bigger factor is lack of exercise. We may be slim, but abdominal fat itself acts as a separate endocrine organ, and people are more prone to Indian population is. Heart disease is also common in Indian population. Our cooking habits are a little bit different. We fry everything, and trans fats are a bigger factor in that. So that is also one of the factors in.
You also interestingly mentioned about the India and traveling. So those of us who go to India with families and kids and all and come back. Again, we are asked to take some vaccinations and all those things. What are the things we should be doing before going to India?
Well, vaccination is also part of the yearly exam. You discuss about it. Lately, pertussis, which is making coming back, and it's more common. So anybody 50, 55 and above, particularly lot of first generation parents are becoming grandparents, so we advise them to get that because they will be interacting with grandkids. But if you're traveling, you definitely should have your Hep A, Hep B because it's very common, and people with diabetes, they're recommending Hep B, they should get it. But hepatitis A is to the minimum, you should have it.
So how long it lasts, like that vaccination? It has to be done yearly basis, or before you go, or?
Absolutely. Try to do it earlier. It requires a couple of weeks to take effect, body to create immunity. So if you do little early, it will be fine, and after first dose in Hep A, you can in 6 months repeat the dose. So it will be fine, it will be lifelong immunity. And hepatitis B is more or less similar, but it is a 3-series vaccination. So people with diabetes or chronic illnesses, a lot of people with heart diseases, other diseases which suppresses immunity, it's better to take these things because these things are also increasing in
and let's talk a little bit about controversial topics,
Sure.
So when it comes to whether Indian or non-Indian population or Caucasian population,
Yes, please.
You have also a lot of issues with sexual dysfunctions, right? And then it involves, the Viagra and taking all these medicines. Is this also part of the regular preventive care or exam, or?
Yes and no. Yes, because this becomes a issue when patient complains about it.
Right.
A lot of data and studies are coming out, and as young as people in 40s could have 40%, in 50s could have 50%, and as the age increases every decade, will add to the percentage amount of increasing. Earlier, good old days, people would not talk and discuss about it, but nowadays...
Now I can sit down and talk here on camera. Yeah.
Yes, we are talking very openly about
Sure.
these things, and
Sure.
people come, and I have not even a single person shying about asking this thing, because it is definitely is a problem. It's not like it is just a psychological issue, it is a real problem also.
It's a physical problem.
It's a disease.
Or medical,
it's
yeah,
a
yeah,
medical
yeah.
issue. It's
Sure.
a medical issue.
Yeah.
Let's put it as simple as it is. There
Sure.
could be many causes of it. Bigger causes, as I mentioned, the coronary artery disease, which is the heart disease, is people who complain of erectile dysfunction in men do have a problem which translates into early getting coronary artery disease also.
Sure.
So you need to make sure that in the physical exam you check those, and preventative strategies are discussed with the patients about heart disease as well as about high blood pressure, diabetes and all those, and obesity. Because these are the main issues which are affecting common population, and these issues are one which can be controlled.
Sure.
There are a lot of factors. You cannot change the ethnicity, you cannot change the age, but there are a lot of preventative factors and modifiable risk factors you can cut down.
So now let us stay on this topic for one more minute. And that is, my question is that, you go to internet, television, wherever you go, you are bombarded with these ads for Viagra, right? So how safe it is or how unsafe it is, and what one should do?
Well, you have to check. Sometime, you want to do hormonal profile checkup in your exam when they complain about it. And they
So
can
it's called hormonal profile check?
Yeah, you check, different hormones, and you want to make sure that you're not missing if there is something, hormones which can, be modified, or their deficiency of something which is causing it.
Right.
Initial testing, and after doing the history and physical exam, you can definitely prescribe these medicines. They do have side effects, which you need to tell your patient that these things could be expecting these things, some of which are very difficult to accept, but it is there because it's a medicine. There is a lot of interaction which has been discussed a lot about coronary artery events and the Viagra, use of Viagra. Basically, what it happens, it was developed as a high blood pressure medication, and during studies we found the side effect was people were having a very good reactions. So in the end of the study, people who were on Viagra, they didn't want to.
I didn't know that. That's interesting.
No,
too.
it
Yeah,
was an
sure.
interesting point. So when they asked them to stop it, they just kept coming back to doctors that we need our study medicine because they were very happy in their personal life.
Yeah, excellent.
So with that, lot of medicine, discoveries are incidental due to something we try and we find something else.
Wonderful discovery.
Wonderful discovery. And there are other discoveries also which are similar, and I
sure.
can cite some examples of that also.
Sure,
if,
sure,
you know.
sure.
So with that discovery, they dwell upon it, and they started working towards it more and more. And now there are much more compounds are available after the parent compound. Viagra is the oldest one, first one came in. That's why it is more popularly known. But there are other 2-3 more medications which are used. And nowadays people.
So what are those other, just for the name's sake?
One is called Tadalafil, which is sildenafil, tadalafil, and names, market names, I can give you Viagra,
Okay.
the Vitra,
Mhm.
and Cialis.
Okay.
So Cialis has been studied in a daily dose as well as longer acting doses. One
So
of
these
the,
are also, there is difference for the men and women too, or is it?
well, they have not been studied in women.
Okay.
So these are the medication for men.
Men, okay.
So women have a different kind of problems, which I usually don't deal with it as much as.
Okay, so I'm going to spare you from that.
Yes, so I don't
Okay.
usually,
Okay.
but there are, screening exam, this thing doesn't come up in women
Okay.
most of the time. But in elderly population, this is usually under 50 and above 50, both problems, this
Yeah,
one.
excellent.
But in people who are 65 and above, and they're in Medicare age group and everything, and elderly population 75 and above, you want to make sure they're not osteoporotic, which is more common, in women. But 50% of women with osteoporosis are prone to catch fractures.
Yeah.
And 30% of men even can catch the fractures, and they can also have osteoporosis, which is unusual, but men do get it.
Excellent.
So the problem is death in our elderly group is due to, most of them can happen if they fall, they hurt, they break the bones.
Mm.
A lot of people die because of that.
Yeah.
So, it is very difficult,
No.
but you need to address the exercise because of that.
Mm.
And in that age group, when they come for your physical exam or yearly preventative exam, you want to make sure that fall prevention is definitely discussed. Exercise is discussed. Their capability, activity of daily livings are discussed with them, that how much they can do. Are they scared of anything? Top of it, one should not forget, as a physician and primary care involved in the medicine, that is there any family violence, which can be part of under 50 also and above 50 also.
Mhm.
So that is also.
So that's another interesting thing you raised, that we just don't think about that. That can be.
We don't, but these are the things. So when somebody doesn't go to their yearly exam, lot of things which could be addressed early, they can get missed at times.
Right.
And there is a loss. Unless you communicate to your physicians, it is not going to happen. So it's much easier and better to see at least once a year. If you have problems, you will see every 3 months or 4 months, whichever your doctor schedules, depending on your progress and your control of the disease and the medications you are taking, and how frequently he wants to adjust those.
Yeah.
But these are the things which are needed.
Excellent. Well, Dr. Kanjolia, thank you very much for coming
You're
to our
welcome.
studio, and we are looking forward to listening to you at the Health Expo.
Thank you. Thank you for inviting.
Thank you.